Hi there, are you at risk for having a stroke, or do you know anyone who may be at risk for a stroke? Having those symptoms of numbness, tingling, headaches, or just having symptoms that they just cannot explain and they're wondering, what is going on? Well, in this video, I'm going to be talking about the very basics of strokes. And at the end of this video, you will know what to expect if you're having a stroke, when you're having a stroke, and what to do about the possibility of you having a stroke, or just the idea of you having a stroke. So stay tuned, I'll be right back. Welcome back to our YouTube channel. My name is Dr. D. Terrence Foster. If this is the first time that you're joining us, let me just extend to you a very special and warm welcome to you. Wherever you are in the world today, I want you to know that I appreciate you joining us today. Also, I want you to know that on this channel, we focus on simplifying medical issues, particularly for those who may have felt left out. This is your channel. Feel free to subscribe. We produce a new video every week. So let me begin. So what is a stroke? A stroke, or its medical term, Cerebrovascular Accident CVA, is an acute neurological dysfunction of vascular origin that occurs when a blood vessel supplying the brain is either blocked by a clot or burst or rupture or has a leak. Now, whenever this happens, that part of the brain is deprived of blood, and hence the nutrient and oxygen it needs to survive. The brain cell will start dying shortly thereafter, and unless, of course, the blood supply is restored. Now, it may take 3 hours to 4.5 hours for those brain cells to die. Some scientists believe that it may take even up to 6 hours, and hence there's a chance of restoring the blood supply and therefore rescuing some of those brain cells from dying. If there is restoration of blood supply, then there's a chance that those brain cells will recover, or at least enough of them will be recovered to maintain or restore the function the brain had before the stroke. Now, in addition to stroke, there is what is called a ministroke, or what is called transient ischemic attack, or TIA. Now, some people may have only a temporary disruption of blood flow to the brain, known as a transient ischemic attack, or TIA. Now, this does not cause lasting symptoms for more than 24 hours. Typically, a concise definition of a TIA is that it's a brief episode of neurological dysfunction caused by a focal, brain, or retinal ischemia, with clinical symptoms typically lasting for less than 1 hour. Now, that is in essence what a TIA is, and it's considered a warning sign to a stroke. So if you're having a TIA, then you are essentially being warned that you may be having a stroke. So if you're having symptoms that are similar to stroke but they're not lasting, then that is a warning sign, and we're going to be discussing some of those symptoms a little later. Now, why are we so concerned about stroke? The reason for that, in part, is because stroke is the number 5 cause of death and is one of the leading cause of disability in the United States. Now, this chart that I'm showing you, you will see that number 1 is heart disease, then there is cancer, then there is accidental injury and chronic respiratory disease, and then stroke, which is the number 5 disease that causes mortality or death in the United States. However, in the rest of the world, stroke is number 2, according to the World Health Organization, where heart disease is number 1. Now, cancer, on the other hand, is further down the list, still in the top 10 in the rest of the world. So stroke worldwide and the United States is a very significant illness, and we should do everything we need to know about it and to make sure that we are aware of it and to know what to do when we're confronted with symptoms of stroke, so we could do the best thing to prevent ourselves from having a stroke. In addition to being aware of those numbers, it's also important to be aware of these numbers from the C.D.C. In the United States, 1 in every 6 deaths from cardiovascular disease was due to a stroke. Someone in the United States has a stroke every 40 seconds, and every 4 minutes someone dies from a stroke. Now, because of the significant impact and disability associated with stroke and the cost of healthcare, there's a significant cost associated with stroke. And in 2014 and 2015, it was estimated that $46 billion was the cost for addressing the issues related to stroke. Now, in 2020, we would expect that number to approach somewhere between $60 to $65 billion. So the cost of stroke as a whole is a significant burden on the healthcare system as well as the economy. The effect of strokes on other countries throughout the world is also very significant. Every country will experience significant impact caused by the disability from stroke, the cost of healthcare, and the time off from work, as well as just taking care of those who have suffered stroke. So it's very, very important. Other statistic, according to the C.D.C, if you are black, you're twice as likely to be affected by stroke, and you're more likely to die of stroke than if you are white. Also, if you're over 65, you're more likely to have a stroke than if you're less than 65. In 2009, a study showed that approximately 2/3 of the people who were hospitalized for stroke was over 65 years old. So although young people do get stroke, the vast majority of people who do have stroke are much older in general. Now let's talk about the type of stroke. In general, there are 2 broad categories of stroke. There's ischemic stroke and then there's hemorrhagic stroke. An ischemic stroke occurs when blood clots or other particles, example fatty deposit or plaque, blocks the blood vessels to the brain. And this accounts for about 85 to 87% of the total number of stroke cases. Now, ischemic stroke is divided into thrombotic stroke, lacunar stroke, and embolic stroke. Thrombotic stroke, these involve large vessels, occurs about 40% of the time. These are caused by blood clots that develop in the blood vessels inside the brain or in arteries supplying blood to the brain. These tend to happen at night or in the early morning, or may be associated with transient ischemic attack, TIA. These tend to affect older people who have high cholesterol or hypertension and tend to develop plaques in their arteries. These arteries then become much easier to develop blockage because of the plaques that are in the arteries. The next subgroup is lacunar stroke. These are smaller vessel stroke and account for about 21% of all the stroke. And these occur in vessels that are small and inside the brain, deep artery within the brain. And they usually become blocked over time due to hypertension or diabetes. Now the next category is cerebral embolism. This accounts for 24% of all the stroke. And this is caused by clot or plaque or debris that travels somewhere else from the body and travels in a vessel to the brain. Typically, in a lot of cases where there is heart surgery or heart disease, this is a case where embolism is more likely to happen. And in the case of heart disease, atrial fibrillation is one of those cases where there's an embolic stroke, which accounts for about 15% of the stroke that occur from embolism. Now, the next class of stroke is hemorrhagic stroke, and there are 2 main subclasses to these. One is subarachnoid hemorrhage, and the other is intracerebral hemorrhage. Hemorrhagic stroke occurs when a blood vessel is leaking or bursts. And when this occurs in the brain, of course, is deprived of blood supply, in addition to creating significant pressure in the area where there is a leak or a rupture. This accounts in general for about 13 to 15% of the strokes that occur in general. The subcategory subarachnoid hemorrhage account for about 8% of this type of stroke. And this occurs when there is bleeding between the space between the brain and the membrane that covers the brain. This may be due to an aneurysm, which is a weakening of the walls of the arteries. And then for those that are hypertension or other factors, this may lead to a rupture of the aneurysm. In addition to what is called aneurysm, there's also arteriovenous malformation, AVM, which is a congenital disorder. And this occurs with the arteries and veins that are not formed and functioning in the normal way. And because of that, they tend to either rupture or leak or break later on in life. It's considered to have some genetic predisposition, and this could occur at any time. So, in short, both ischemic and hemorrhagic stroke are a very dangerous stroke to have and will cause significant incapacitation, significant comorbidity, and mortality. And understanding the symptoms of these are very important. So now that you know what the strokes are and the different type of stroke, what are the symptoms and what are the signs? So let's look at the signs and symptoms of stroke. You may have sudden numbness or weakness in the face, in the arm, leg, especially on one side of the body. You may have sudden confusion or difficulty speaking or understanding speech, or people understanding you when you speak. You may have trouble seeing in one or both eyes. You may have sudden trouble walking, dizziness, loss of balance, or lack of coordination. You may have sudden severe headaches with no known cause. And when you have these things, what should you do? Call 911. And you should do that fast to get help, so that this person who is having a stroke, whether it be yourself, if you're capable of calling, or someone who is in their presence, they would activate the emergency system 991 to make sure that you get seen quickly. Now, FAST is an acronym that also helps to trigger those of us who are there and can see, and even the patient or the person who is having the stroke, they could use this acronym FAST, F-A-S-T. The first letter is F, and F represents face. Ask the person to smile. And does one side of the face or the jaw goes in a way that is inconsistent with the way that person usually smiles, then that's a sign that there is weakness on one side of the face. Then the next one is arm. Ask the person to raise their arm, and when they do, one of the arm will drift. And if you ask the person to close their eyes, then that will enhance the degree to which the arm will drift. So that's something that you could ask them to do. In some instance, if the stroke is severe enough, that person will not be able to lift both of their arms because it will be so weak. But in some instances, if the weakness is not significant enough, you will be able to notice a difference when they raise their arm and they cannot keep both of them out straight, particularly when they close their eyes. Now, the next thing is the next letter in FAST is the letter S, speech. Ask the person to repeat a simple phrase. Is the person slurring, or are they saying things out of sequence, or do you detect that the speech is abnormal? Then if you do, then that is an indication that there's a possible stroke. The next letter is the letter T, which stands for time, meaning if any of those symptoms, whether their face, their arm, or their speech is, in your judgment, impaired or not the way it should be, it's time to call 911. Now, you don't have to have all three of these things for you to call 911. Any one of them, or if you believe in your best judgment that something is not wrong, whether it be the speech, the face, the arm weakness, or any of those, or any sort of coordination, your first thing is to call 911. And when you do, make sure that you record the time when you're doing that. It's very important that you record the time when these symptoms start, because knowing that will determine whether or not the person who is being treated for stroke, whether or not they're going to fall within the time frame where they could get appropriate treatment to address their stroke. Now, this time factor is very important because most of the protocol relies on a 3 hours to a 4.5 hour window of treatment. So the emergency service or the hospital will want to know when did they start. If it's way outside the time frame, then that patient may not qualify for treatment of thrombolytic or clot busting. So what is clot busting drugs and why is it important? These are type of drugs or therapy that are used for ischemic stroke, and they're called thrombolytics or clot busting drugs. And what they do is that they help to dissolve the clot very quickly, when given to a patient within 3 to 4.5 hours of the onset of stroke. Now, there are different types of thrombolytic agent that are out there. The most common one and the gold standard is one which is called IV tissue plasminogen activator, which is also called TPR activase. And this is what is given to most patients when they're being treated for ischemic stroke. Now, there are certain protocol and certain guidelines that determine whether certain patients are qualified to receive this. Of course, they have to have certain tests, for example, a CT scan of the brain to ensure that they do not have hemorrhagic stroke. In addition, if they have certain other conditions that may preclude them from having thrombolytic therapy. For example, if they have a bleeding disorder, then of course thrombolytic therapy would not be appropriate. Or depending on, there's so many other factors, whether they are diabetic and the level of their sugar and their age and their other risk factors, all of these have to be taken into consideration. But these will be evaluated once they get to the hospital, but they have to get there quickly. And once you have determined that someone that you're with is having a stroke, then, as I've said before, you need to call 911. Do not take this patient or this person to the hospital yourself. The first thing to do would be to call the emergency service. And the reason in part for this is once you call the emergency service, they will be able to direct the EMS service that is coming to get that person to the appropriate facility, because not all facilities are equipped to treat stroke appropriately. Some places have what is called stroke centers, and they have everything in place ready to treat someone who has had a stroke, while others do not. They could still treat the patient, but not as effectively. So it's important that you call them, so by the time the patient gets there, they will have a CT scan ready to go, they'll have everything ready to go, they'll have the neurologist ready, and all these other things that they need to ensure that everything flows well and the patient get appropriate care will be in place. But you cannot take the patient to the hospital, or you should not take the patient to the hospital by yourself unless that is the only option you have. But again, for the reason that I mentioned, it's better to activate the emergency service so that they will be prepared once that patient gets there. For thrombolytic therapy to be effective, it must be given within 3 hours to 4.5 hours in most instances. There are some centers that will do or will give thrombolytic therapy up to 6 hours, but that is based on the criteria that they have that is specific to their facility and to the research that they have at hand. There's some complication and possible side effect, one of which I've mentioned before, bleeding, there's hypotension, and there are other side effect or complication that could result from getting thrombolytic therapy. So not every patient is appropriate for receiving this, and of course, definitely not someone who is having an hemorrhagic stroke. In some instances, you may give this to someone who has an ischemic stroke, and they may be converted to a hemorrhagic stroke. So the risk-benefit of that has to be weighed, and that will be determined by the neurologist and the medical team that is taking care of the patient when they arrive at their facility. Now, how is stroke diagnosed? Now, in addition to having the clinical symptoms and all the things that are discussed, the symptoms and signs that occur, those are important. But in addition to those, there have to be certain diagnostic tests that are done. Among them are a CT scan of the brain. Now, this is one of the first things that is done because it helps to determine whether or not, one, there's a bleed in the brain, whether it's an hemorrhagic versus an ischemic stroke. And that will also help to guide the treatment. Once that is done and the patient is stabilized, treated, the next study that is often done is this MRI of the brain, which is usually done later and give a more complete picture of the brain and show other abnormalities that the CT scan may not have picked up on. In addition to that, there may be other studies. For example, there may be an angiogram done. This may be a traditional angiogram, or it may be a magnetic resonance angiogram, MRA angiogram, or it may be a CT angiogram. And these will be determined by the facility and what their capabilities are and what they have available, and also what the diagnosis they think they're working with. That will determine whether or not they ordered any of these angiograms. There may also be a ultrasound, a Doppler ultrasound, that may be done of the neck, a carotid Doppler, or a transcranial Doppler. And that will also help to both the angiogram and or the ultrasound Doppler will both help to identify the vasculature of the brain and neck and help to determine whether or not there's some pathology there that may have been responsible for the stroke. So those tests are very important. They often also look at the vasculature in terms of aneurysm, arterial venous malformation, and clots or bleed. They could all pick up those things as well. Now, in addition, sometimes an echocardiogram is done to look at the heart chambers, to look find clot, to look at vegetation, to look at the heart valves. All that is part of it. An EKG is also done. That will look to see. The EKG will look to see did this patient has an arrhythmia such as an atrial fibrillation or other condition that may have developed before the stroke or after the stroke. When you do an EKG, there's so many different things that you may see there, but looking for atrial fibrillation or other arrhythmia or other findings will also be important in helping to determine and manage this patient in terms of their overall care. A lot of times when patients do have stroke, that cardiovascular disease often cause their death, or a combination of both of those diseases together will lead to the death of the patient. So an EKG as well as an echocardiogram are two important things that will be a part of the studies that are ordered as well. Sometimes an EEG and electroencephalogram is done. This is a case where there is severe brain injury or trying to determine whether or not this person is still has brain activity, or sometimes if there are seizures develop or other reason to determine an EEG, then this will be done as well to, but usually much later on in the process, depending of course on the severity of the stroke. Now it's clear or hopefully is evident from what I've been saying that stroke, the type of stroke you have and the severity of stroke will ultimately be determined by the extent of the blockage, the extent of the bleed, the extent of the leak. And some people will have very minor stroke, where some will have massive stroke, and some stroke will be fatal. So there's a range of different level and severity of stroke that each individual may have. So stroke is not one thing or one class of illness, but it's a continuum, and it's a range of illness with different levels of severity and different level of outcomes. So are you at risk for stroke? Are we at risk for stroke? That's a big question. Approximately 80% of the strokes that occur are preventable. The bottom line though is that anyone could have strokes, whether you're young or old. You could have a stroke. As I said before, 800,000 people in the United States alone is will have a stroke each year. And worldwide, it's the second cause of mortality in the world. So stroke is a big deal. And it's a big deal here in the United States. It's a big deal in the rest of the world. So it's important to know what to do and how to prevent it. So let's talk about some of those things that we could do to prevent strokes. Now, of course, there's some things that we have no control over. We don't have any control over our age. We all get older. We don't have any control over our ethnicity, what race we are. We don't have any control whether we're male or female. These are all factors that in some way will determine some stroke outcome and some statistics that are different. But there's certain things that we could do to address lifestyle. For example, smoking, drinking alcohol, sedentary lifestyle, unhealthy diet, obesity, illegal drugs, abuse of prescription drugs. These are some of the things that if we're doing these things, they will increase the risk of strokes. Now, there are medical things that we could do to improve the condition or to decrease the risk of stroke. Many of these are common and some of them we all know about. For example, high blood pressure is one of the leading causes of stroke. And if we can control our high blood pressure, then we have less chance of having stroke. We've done a series on including high blood pressure. Make sure you check that out. Control your cholesterol. Make sure that you eat healthy diet. That will also reduce the amount of cholesterol and fat intake that you have. Heart disease is a major factor. Make sure that you're monitoring your heart disease, because if you have heart disease or condition related to your heart, whether it be valvular disease, whether you have some sort of arrhythmia like atrial fibrillation, all those can contribute to having or increasing the risk of you having a stroke. If you have sickle cell disease, that's another factor, because when you have a sickle cell disease, then those blood cells, they tend to take on configuration or different shape. So therefore they could block or create, make the possibility of clots forming much easier. So that is something that you want to bear in mind as well. Of course, diabetes is one of those other factors where controlling your diabetes is important, because that also affects the integrity of our blood vessel, leads to greater plaque formation and changing the structure of the blood vessel wall in so many different ways, and affects or increase the risk of having a stroke. So be aware of that as well. Make sure your diabetes is appropriately controlled. Other factors that also goes into this is, if you are obese, make sure you lose weight and be within the right frame weight. Exercise is important to help control your weight, as also help control your overall health condition. That is important. Now, another factor that also can reduce the risk, sometimes some people will have a blockage or a partial blockage of their of the blood vessel in their neck, their carotid artery. If you have a blockage somewhere between 70 to 99% of any of your carotid arteries in your neck, then you're going to be at increased risk of having a stroke. So if you're having any symptoms or sign or anything that you feel, make sure you let your doctors know, so that they could, if they see it necessary, to also make sure that you're examined, and if necessary for you to get some sort of diagnostic test to make sure that you're not at risk for having a carotid that is almost completely blocked. If you have a carotid that is almost completely blocked, there's the surgical outcome for these are pretty good, and they could put a stent in there, go in there, remove a plaque or clot or whatever is blocking it. Those could be fixed fairly easily. So make sure again that you consult with your doctor for any symptom that you're having, whether it be stroke related or anything that you don't understand. Make sure that you consult with your doctor. so that they are your medical provider, so that they could make the appropriate recommendation. In general, high blood pressure, high cholesterol, smoking, obesity, and diabetes are the leading cause of stroke in the US today. 1 in 3 people will have one of these conditions at least who have had a stroke. So be aware of that and know that those are significant risk factors. And overall, by making modifications of your lifestyle, as well as some of those medical conditions, those can be modified and result in improvement and decrease of your risk of having a stroke. So how is stroke treated in general? And this is a topic that is so wide, so what I'll mention here are very limited in that. But in general, there are a few steps that you could do to ensure, one, you don't have another stroke, and if you have one, here are a few things you could do. Number one, rehabilitation. And this will help to restore the functionality that the patient has lost. Whatever function they have lost, this will help to optimize and restore that function. This is essentially a team approach where you have a medical doctor and other therapists such as physical therapists, occupational therapists, speech language pathologists, nurses, social worker, all working together to ensure that this person who has had a stroke will regain as much of their function as they have lost, and to reintegrate them back into society so that they will have a more productive life, regardless of the level of impairment that they may have as a result of the strokes that they have had. We have talked about lifestyle modification. All those things are important, right diet, making sure that you don't do some of those things that make you at risk for having, those things have been discussed. So if you know the things that cause you to be at risk, don't do those things, then of course your chance of not having a stroke will be significantly improved. That is, if you adhere to those things that are important in reducing your risk of stroke, then there's less chance of you having a stroke. In addition to that, of course, there is making sure that you're really working very closely with your medical providers, making sure that you are being treated with the appropriate medication. There are a lot of medication that are out there. Medications such as antiplatelet medication. These could be aspirin, Plavix. Then there's anticoagulation like Coumadin, Xarelto, and so many others that are out there. Then there's the statin for cholesterols and antihypertensive medication. There are numerous of them that are out there. So make sure that you're aware of what these are, and that your doctor will, of course, work with you on making sure that your medical status is optimized, so that you will at least have a better chance of surviving a stroke if you have one, and reducing the risk of a stroke so that you don't have one. Now, there's something that you may come across which is called the ABCs of stroke prevention, which is aspirin, which may help to lower your risk of stroke; blood pressure control, that's a B, control your blood pressure; and C, cholesterol control. And then stop smoking, or do not start if you have not been smoking. Now, within all of these, there are mortalities, and in addition to the morbidities or the health condition that are there are people that are dying from stroke. So why do people die from stroke? The most common reason why people die from stroke is the stroke itself, and that's from the cerebral edema. Then some people die from aspiration pneumonia because of the feeding difficulty. Then there's cardiac related issue, whether it be cardiac arrhythmia, or they may have a MI, myocardial infarction, or other reasons that they may die. Some may also die from pulmonary causes like pulmonary embolism. Those are some of the main causes why people will die from strokes. Overall, stroke is a very serious issue and very complex. What I've done in this video is, it doesn't even touch the surface of strokes and stroke treatment or its rehabilitation. But hopefully what I hope this will have done is to give you some insight into stroke and at least some of the very basic. I've spent a lot of times over my career taking care of patients with stroke as a medical director of a rehabilitation center for over 10 years. So I know that what I've given here is only a small sample of what stroke is, the involvement of stroke, the care of stroke patient, the rehabilitation process, and the whole gamut that involves treatment of stroke. There's just so much information that are out there in stroke that, of course, this is only a sample. But I hope it's helpful, and I hope you do get something from it. And I hope that you will learn enough to know to do something whenever you believe someone is having a stroke. That is essentially the essence of what this video is about. So I hope you got that out of it. I hope this overall presentation is of benefit to you and your loved ones. I'm going to leave some links and website at the end of this video. So I hope you check some of those out and try to expand on your knowledge of this, because this is a very, very important topic. So I encourage you to like, share, and comment on the videos on this channel. Share it with your friends, family, or anyone. I also encourage you to subscribe to this channel. It's free. And when you do, make sure that you hit that notification bell so that each time I release a new video, you will be notified. Finally, let us always remember, each of us should strive to keep a healthy mind and body. Thank you so much for watching.